So I'm Eli Perez. I'm a retina technician at Miramar Eye Center. I've been working with retina for about 5 years now. I'm with Miramar for 4 months. I've been in the medical field for about 5 years. I was an EMT for 1 year. Recently married. Consent to be interviewed and recorded. Yeah, so I work for a retina surgeon in Miramar Eye Center, uh, and I work probably one of me and another male role in this office, predominantly mostly women here. But I've been in the medical field for about 5 years. Been Most offices I've worked in are predominantly female, uh, but it's always been a fun environment. I always learned a lot. Never let that get in the way of me being a professional in my job. Never let gender roles dictate my performance as a worker, which comes first. And but as far as me being a male in a predominantly female uh, field, I feel that has not really swayed my performance at all. So on a typical day that we do, we see a lot of patients that come in for retina exams for their eyes. So a lot of patients come in for diabetic disorders, referrals for diabetic disease or macular degeneration. So what we do, we basically see a patient, we go over their medical history, go over what their problems, their issues that they're having with their vision. We jot that down into the software that we have for the computers. We get their eyes ready for the doctors, get them dilated, and we do any testing that's required for that patient as necessary for the doctor to be able to diagnose them perfectly and precisely throughout the day. In our office, there is no, as far as performance based on gender, so we all are equally doing everything that we can to make sure this office flows correctly and that the doctors get what they need for their patients. Gender is not a priority in the sense of the workflow. So I have not come across that. As far as just because I'm a male, I have to do certain things, or because I am a man, I only can do this and not do that. I've not come across that, but as a worker for the retina surgeon, we all perform to what is needed for the office and for the doctor. Not really an issue. I haven't really ran into that as far as me being criticized because I'm a male or being judged because I'm a male. I haven't really ran into that. I know me as a male role has been used for a positive in the sense for if we do have patients that come in that are a little disruptive or that if they see a male present, the scene can kind of be calmed down a little bit more and are handled because they see a male in the office. But I haven't been used for my gender role to be a negative though. Well, I've always loved helping people. I've always loved being an avenue to help somebody, and this is the best way. The eyes, I've always heard the eyes are the windows to your soul. So if we can help someone's vision to see their grandkids or help their eyes to see their future son graduate or what have you, I want to be part of that journey. So eyes have really been a big part of my life because it's helped me see a lot more in depth of health. The toughest part of my job is processing a lot of information in a day for multiple patients. I think the stress of knowing that you have someone's life, also their medical history, you have the stress of different people's characteristics is very stressful. But the challenging part is trying to process everything in a day. But I think it's very rewarding at the end of the day, though. My favorite part of my job is getting to learn something every day, brand new, and getting to be able to help someone in the process. Every day is different with every new patient that comes in, and getting to learn at the same time new diagnoses, new diseases, new ways to help treat it is always a benefit for me, and helping someone on top of that just brings more enlightenment to it. My greatest achievement in the workplace was a long time ago, about 3 years ago, we were able to do an emergency on a child patient who was suffering with a very serious issue with his eye. And our team that was, at the time where I was at a different practice, we were able to save that eye because of the steps we took as technicians. and that child is seeing today because of what we do, because we took the proper protocols, we did the proper orders, and we were able to do that in an orderly fashion. And that was a great achievement in my medical career.